Hello, everybody. My name is Connor Lynch with Westwood Media Center. Today, I am joined by Chief John Deckers, the fire chief of the Westwood Fire Department, in order to figure out the direct impacts that COVID-19 have had on operations and the fire department in general. So, Chief, thank you so much for joining us.
My pleasure to be here. I'm glad I could take time out of our schedule to get some information out to the public on what we're doing here.
Absolutely. So I'm wondering if you can talk first about some of the safety precautions that are being taken by first responders, not just in a case that has to deal with COVID-19, but also just in general. How has that impact been?
Well, our business is a little bit different because we respond to fire and medical calls. When we respond to medical calls, we are responding in a position where we're using protective gear, which we call PPE. It's personal protective gear. And so we already have that equipment. Though there is a shortage, as people have been hearing on the news, there is a shortage. However, our EMS coordinator, Michael Crawford, saw this very early on and was able to address that by ordering in advance. So we've been in a really good position equipment-wise. Though we had to allocate the equipment differently and try to use certain types of equipment only for our COVID positive properties. So it really hasn't had a major impact with the way we do business. We just changed ours around a little bit operationally.
Absolutely. I'm wondering if you can talk a little bit more about the impact of response times, if there has been any, or if there has been a little bit of a delay in getting out to people who need help.
Yeah, so we have not experienced a delay. We have very strict standards we have to operate under anyways. So we have to maintain certain response, and our people are now responding out very quickly, so we get on site quickly. What we've done is we've changed our method of operation, where in the past you'd have the entire engine crew in an ambulance walk right into your home and do the assessment. Right now we only have one paramedic enter your home, and we also have it, if you're able to, our dispatchers actually ask you to remove yourself from the home and meet our staff on their front on your front porch. So that we stay out of your home, and we work it that way. So then once that paramedic does their initial assessment, then they'll reach back to the other responders for the other resources they need, and also develop the level of PPE that we're going to be utilizing during that incident.
And I guess my next question would be a little bit more about, we're talking about response times and kind of active situations, but for day-to-day operations, I'm wondering if you can talk a little bit about how, the daily life in somebody who's on the fire department has changed since all this has gone on.
Yeah, so there's definitely some change there because our normal operation, the folks will come in at shift change, they'll get things ready, they'll, prepare the firehouse, they'll clean up, make sure everything is good and clean and ready for their 24-hour shift. Then they start to work on the rest of their day. They're going to be doing pre-planning, which is going out into buildings and doing inspections and documenting that so that we have this information before an incident occurs. They'll also be doing training and then other types of inspections like fire alarm and smoke detector test and the such. So we're not doing a lot of that now. Our firefighters come in, they clean up, they prepare, and they're basically running just calls. We do a little bit of training inside, but we've reduced the amount of training we do outside. So they're doing a lot of book work, staying up on that, staying current on their paramedic license, which they do all the time, but now we have more time to devote to that. So we're actually getting, I would say, better at that. And a lot of our administrative staff, those that can work from home, like our office manager, she's working strictly from home, and we're providing her information back and forth so that she can do her job to reduce her potential exposure. And then my training captain had been reallocated to the line to do some line response to actually run calls. We've now pulled him back into the office because we actually on Monday just started a brand new firefighter. So we had the opportunity to take a new person on, and we weren't going to let COVID get in our way. So we've brought him on. He's a certified firefighter and a paramedic already, so we just have to teach him the Westwood way. So that's what we're working on now with Chris Pierce. He's handling that with our new firefighter who will be on the line shortly.
Absolutely. I think it's kind of also nice. A lot of people hear about people losing their jobs or not having to be laid off or anything like that. And yet in the midst of all this, we're able to bring another firefighter on in order to help out. And I think that that's a nice change of pace that a lot of people might not hear about.
Well, one of the things the firefighters here in town truly understand is we know we are blessed to work for this great community. We don't mind serving for the community, and we want to give it all back to the community. So kudos goes out to the administration and the finance department and everything to make sure that we have the funds to be able to do what we need to do at a moment's notice.
Absolutely. We're very blessed to have the town that we have.
Absolutely.
I wonder if you can talk a little bit about some of the efforts that you have made with other organizations in town. I've noticed there's a lot more postings about, like, for example, the food pantry. I'm sure there's been a lot more collaboration between your department and, the police station, for example. So I wonder if you can talk a little bit about some of those unique collaborations that have become a lot more important nowadays.
Sure. So again, we've been pretty blessed since the beginning when I took over back in November of 17. I was able to strike up a great relationship with the police department and public works and basically all the department heads in town. So we work seamlessly together. So we've built, even prior to COVID, we were building a public safety umbrella where all of us work really well together. But what we've done during COVID is we've had to spin up some other connections and working with the food pantry and Westwood Community Chest. Because a lot of our folks are impacted by this and they've lost their jobs and need a little extra help, which is okay, and we're trying to be there for them. We've made recommendations, as much as we appreciate the support from the community, that folks don't stop by and drop food off at the firehouse for us in an effort to keep ourselves safe, because we just don't know what's coming in. We can control what we bring into the firehouse. We can't control what people bring to us.
Mhm.
So in an effort to control that, I ceased accepting all of those donations, which I know is very difficult because people want to say thank you. But we're hoping that after this is all over, when we open our firehouses back up again, we'll have an opportunity for people to come by, say thank you, bring treats and all that kind of stuff. And we'll be back to what is going to be our new normal. But we're hoping to get back to a point where people can come to our house and we don't have to go to their house.
And I'm sure people are going to be very appreciative of the ability to give back, because the amount of work that's been going in from everybody, but especially from the fire department and the first responders, has always been incredible. So I'll
Sure.
take a moment. Thank you. It's
Yeah.
been truly incredible to see the work going on.
Yeah, and we appreciate that. And like I said before, we do this because we love to serve. And this is as I've said before, is a great community to work for, who has a lot of respect for their public safety. So when you have that, it's like, it's the perfect situation.
Absolutely. If people wanted to get in contact, if it's whether or not it is an emergency or not, what is the best way that they can contact the fire department?
Well, we're asking that everybody still utilize the 911 system for all emergencies. And we would consider, even if you had, what you would consider a minor medical incident, that you treat that as an emergency and you call 911. We take all of our response calls. If you're looking for a fire truck to come out to your house or an ambulance, please call 911. If you're looking to get a hold of some information, just routine calls, try calling our public information officer, Carolyn Wade. She can handle probably 99% of the calls and route them in the right direction. If you're looking for fire prevention information, please call our Deputy Chief, Rich Cirillo. He's definitely the candidate that can make sure all those needs are addressed. And all their information can be found on the town's website under the fire department. And if you need to call the station routinely for anything that's non-emergent, you can call us at 781-320-1060.
And I also wanted to talk a little bit about the spread of information. Obviously, in the days of social media, everybody's kind of getting online and seeing more stuff. And I'm wondering if you can talk a little bit about some of the efforts that have gone on from the fire department to keep residents up to date and what they can do in order to stay up to date.
So we have set up a social media network that's internal to the fire department, and then also we work very closely with our local 1994, who have an incredible social media presence and have been providing a lot of great information on what the department does and how we respond to calls and what to do during this COVID emergency. So they handle really the incident response side of our business, and the chief's office, my office, along with Carolyn, we work on the educational component of what people can do in town, such as, what should you be looking for in your home, and smoke detection and alarms and all of that stuff. And then also during this COVID emergency, we take a lot of information we receive from the Department of Public Health, FEMA, CDC, and we rebroadcast that, and then we also take it and package it into social media messages that are going to help us as a community.
Absolutely. That's kind of all the questions that I had for you. I wanted to kind of turn it over and leave you with any parting words that you wanted to leave residents, or any message that we didn't go over today that you think we need to emphasize.
I think we covered a lot, Connor, and I think the most important message for people to realize is that we are here. We're here 24 hours a day, 7 days a week, 365 days a year, unless it's a leap year. We're here one more day. We'll always be here. And we're just a phone call away. No matter what it is, just give us a call. We'll respond and work it out. But just everyone keep safe, keep calm, and just follow the direction we're getting from the CDC and the Department of Health and social distancing, and don't rush back into this. As a community, we've been blessed so far as this whole case goes, and we just want to keep that forward movement.
Well, Chief, seriously, I want to thank you for taking the time out today. I'm sure you guys got a busy schedule over there, so we really appreciate it, and hopefully we can get the messages out to people.
All right, we're here for you anytime you need us, Connor. Thank you.
Thank you.